the pandemic is getting hotter and it's getting to be dangerous also because maraming variants naglabas ngayon. India, UK, Africa. We do not have a guarantee that the vaccines will be forthcoming on time na walang maraming mamamatay. And if it is more a serious mutant variant, we will just have to prepare for the worst.
Karagdagang 10 kaso ng India variant ang naitala sa
Recently, the Philippines detected 12 confirmed cases of a variant of the COVID-19 virus first detected in India, or the B.1.617, from returning overseas Filipino workers.
There should be a cause of concern. This virus variant is highly transmissible. Then this can be a possible surge of another surge of cases in the Philippines if we will not contain it.
The World Health Organization declared the variant first found in India a global variant of concern after being seen in over 40 countries around the world. Some experts say this variant could be one of the factors that contributed to the surge of infections in India from April to May 2021.
This contains at least 15 mutations and there are two significance na binabantayan po natin. At ito po yung L452R and the E484Q.
Based on initial research, these mutations or changes in the virus may affect how fast it spreads and reduce the ability of antibodies from vaccination and other treatments to recognize and disarm the COVID virus. But Solante says the variant first found in India is not totally unique from the other variants of concern first identified from the United Kingdom, South Africa, and Brazil.
A mutation that is found in the Indian variant is more or less in the same site where the other three variants of concern have their mutation, in the receptor binding domain and the spike protein. And when you have mutations at that site of the virus, that will evade our immune system. So it can pass through our immune system and infect us readily.
And so, apart from practicing minimum public health standards, experts emphasize the need for better sequencing and contact tracing to understand the spread of this new variant of concern.
We need to really monitor and do regular genomic surveillance so that we will know the extent and proportion of the Indian variant among our confirmed cases of COVID-19 here in the Philippines.
Solante also highlights the need to increase the pace of vaccination.
If this variant will become the dominant variant and our vaccination rate and rollout is so slow, chances are we will be having more of these cases at the expense of life, at the expense of more people infected, and at the expense of our economy.
According to Dr. John Wong of the IATF Task Group on COVID-19 variants, the Philippines needs to be inoculating 350,000 adult Filipinos a day to achieve its 70 million target for herd immunity. The DOH has tallied only an average of about 160,000 shots daily as of May 22.
There are vaccines that may be more protective against the variants, but all vaccines will minimize transmission and severe illness of any of those variants.
Since January 2021, the Philippine Genome Center at the University of the Philippines has detected local infections with the variants of concern first identified in the United Kingdom, South Africa, and Brazil. Against the new variant from India, some preliminary research indicates that vaccines using messenger RNA like Pfizer-BioNTech and Moderna and the viral vector platform like AstraZeneca could still work. The Philippines has started administering over 193,000 doses of the Pfizer vaccine and more than 2.5 million AstraZeneca jabs it received from the WHO's COVAX facility. Ultimately, health experts say the only way to prevent further mutation of the virus is by cutting the transmission through vaccination. As of May 22, less than 2% of the target 70 million adult Filipinos have completed their 2 doses of COVID-19 vaccines.
We need to fast track the vaccination rollout, especially in the National Capital Region, where the cases that has had an Indian variant were detected. The longer the virus stays in the community and more people will be infected, the higher is the chance that there will be more mutations and more new variants of concern.